Today we're going to be discussing everything that you want to know about gabapentin. Hi, I'm Dr. Josef Witt-Doerring. I'm a board-certified psychiatrist and expert in adverse reactions for psychiatric medications, and we're going to do a deep dive for gabapentin today. As always, the information that we're going to be discussing is coming from the NIH, that's the National Institute of Health, their website, which hosts the most up-to-date drug labels for these medications. So let's dive into gabapentin. The first thing that I think is interesting to talk about with gabapentin is the indications and use. Now, this is what Pfizer originally brought the drug onto the market to treat. And you'll see that it's brought on for post-hepatic neuralgia. This is neuropathic pain that occurs in people who have shingles. And the other condition was for partial seizures as an adjunct, meaning for on top of another epilepsy medication. What's interesting is probably you're in the majority of people who are hearing this and saying, I'm not taking this drug for those conditions. And that's because gabapentin is used widely off-label for a number of different things. And so much so that there was actually a very notable lawsuit that happened between the US government and Pfizer in the mid-2000s. And so what they were alleging at the time was that Pfizer was promoting this off-label. They were going out to doctors and saying, hey, have you considered using this for migraines, alcohol abuse, anxiety, fibromyalgia? They were planting this seed in the minds of doctors all around the country to, hey, maybe you should consider doing this off-label. And that's essentially illegal. You're not allowed to do that as a drug company. You can only market towards the indications that you brought the clinical trials onto. So while it's okay to try some of these things off-label, they were marketing it broadly. And honestly, that's what I see today is most people are taking gabapentin for not these two reasons. And so, like I mentioned, it's anxiety, migraines, diabetic neuropathy, sometimes alcohol withdrawal, fibromyalgia. There's a range of things people take this for. Before we go into it, just a brief talk about the pharmacology of this drug. What exactly is it doing? So it's called gabapentin. So it might make you think that it's acting on the GABA receptor, but really it's not. It's acting on the alpha-2D subunit of calcium channels. These are channels on neurons which control how the neuron fires, essentially. And essentially the effect of the gabapentin is to reduce the excitatory neurotransmission. So think things like glutamate. And so this is going to reduce neuroexcitability. So let's go into its dosage forms and strengths. Gabapentin, it normally comes in like 300, sometimes 600, sometimes 800s. So you can get it in tablets, you can get it in capsules. You can also get it in oral solution as well, which is quite readily available. The dosage range that people usually take is anywhere up to 1,800 milligrams a day. I think that is typically the max that it's still effective, but some people can go higher. And when you're starting this medication, you'd usually start at about 300 milligrams a day and kind of slowly move up from there depending on tolerance. Moving on, we're going to talk about some of the most significant side effects of the drug. So first one, so we have a drug reaction with eosinophilia. Essentially what I want you to think of is systemic inflammation. In a small proportion of people who take gabapentin, it messes with their immune systems and they can get inflammation in multiple organs. Think systemic inflammation, think autoimmune. And so you might not have rashes, but you might feel very feverish, very lethargic, kind of sore joints and things like that. If you've just started taking gabapentin and you're starting to have these things, you want to be thinking about its propensity to cause some of these immune style problems. Now that goes straight into the second risk, which is the risk of anaphylaxis and angioedema. This is essentially, again, more immune problems where people will become short of breath, they'll get puffy eyes, puffy mouth. This can be life-threatening because some people stop breathing when they go into anaphylaxis. Next, we're going to talk about the effects on driving and operating heavy machinery. This drug is very sedating, and because of that, when they've done tests with gabapentin, they have found that it actually impairs driving and it impairs the operation of heavy machinery. So if you're taking this drug for the first time, you want to be very mindful about sedation and also dexterity. And that brings us to the next risk, which is about somnolence and sedation. Again, this drug clearly makes people feel sedate and sometimes a little muddle-headed. If you're having these problems, that is a common risk with gabapentin. You also are going to want to be on the lookout for things like falls because of the dizziness associated with this drug. Next up, we've got withdrawal seizures. So, gabapentin is preventing the excitatory tone in the brain. It's stopping the amount of glutamate, which is the excitatory neurotransmitter in the brain. And so over time, because the brain doesn't like that, it's going to kind of fight against the drug, and those excitatory receptors and neurotransmitter systems in the brain, they're going to upregulate to push against the drug. And so what happens is if you suddenly remove that drug, all of a sudden your brain is going to be in a very excitable state, and you might have something called a withdrawal seizure. And so this is not a drug that you want to stop quickly, especially if you have epilepsy and you're predisposed to seizures. Next up, we've got suicidal behavior and ideation. This is a class-wide warning for all the anti-epileptic medications. And essentially, it's relevant to any medication which acts on the brain. These drugs do not have the same effect on everyone, even though they mostly will cause, sedation, maybe some anxiety reduction in the majority of people. Some people will have paradoxical side effects. And some of these things can be rage, agitation, especially if you're depressed. These can predispose you to suicidal thoughts and behaviors. So whenever someone's taking a neurologically active medication, we're going to look for unusual changes in their mood and behavior that's really not based on the context of their life. And we want to consider the drug maybe playing a role. Okay. Next up, we have respiratory depression. This is mostly a risk when people are taking multiple other sedatives or opiates. So if you're taking Xanax, Klonopin, Valium, if you're on methadone or fentanyl or OxyContin, all of these other drugs which cause respiratory depression, if you take it with gabapentin, the risk goes up. You could go to sleep at night and you might not wake up, because that's how people pass away from respiratory depression. It suppresses their respiratory drive and essentially they stop breathing. Mostly a problem when you're taking multiple sedatives together. And now we have neuropsychiatric adverse reactions. Now, they specify this in pediatrics 3 to 12. That doesn't mean these things can't happen in older populations. It's just that if you're younger, people tend to be at higher risk of having these psychological adverse reactions, things like agitation, rage, mania. So again, you want to be on the lookout for these, especially in younger individuals taking the drug. Next up, we have the tumorigenic potential. So this is the propensity of this drug to cause cancers. Now, what they found in their animal studies was when they exposed rats to this for a period of time, they had an increased risk of pancreatic cancer. It's unclear whether that translates to humans, but the company put it in there. So there is a potential for some increase in cancers, although we haven't seen that in the human clinical trials. So far, it just exists in the rat studies. Sudden unexplained death in patients with epilepsy. This risk is just talking to the fact that in their clinical trials, some people died unexpectedly. Before you panic about this is kind of a hard one to make sense of, because sudden death in epilepsy is actually a thing. So it's unclear whether the drug is causing it or whether it's happening simply because of epilepsy. But Pfizer, the company, does think it is important enough to bring up with people who are taking this medication, because they are considering it a potential adverse reaction. So next up, let's talk about the adverse reactions that were observed in the clinical trial. This will give us a sense of simply how common they are. And the first one we're going to look at is a clinical trial for post-hepatic neuralgia. These are the people with shingles who had a lot of pain. This is a great one to look at because unlike the other clinical trials where it was using gabapentin on top of another epilepsy med, this allows us to see what it does just on its own compared to a placebo group. And so the things that you want to look at, a lot of this is fairly similar, but if you come down here, you're going to notice a lot of dizziness and a lot of somnolence. That's like feeling sedated. So we've got 28% of people are feeling dizzy on this drug compared to 8% in placebo. 21% are feeling sleepy and fatigued compared to 5%. That just gives you a sense of just how common this is when people take gabapentin. So those are the main ones to look at. There are some other interesting things in here, actually. So these are the studies, again, when people were taking gabapentin as an add-on with another anti-epileptic medication, and you actually see more adverse reactions. So now we start to see people, when they're combining it with another anti-epileptic, they're starting to have more fatigue. They're starting to have more ataxia. Ataxia is kind of a wobbliness. They're starting to have tremor. And interestingly, as you go down here, if we go onto the other side, they're also having double vision as well, so some blurriness of the vision, and there's an increased risk in viral infections as well. So you can see here we've got 11% compared to 3%. So maybe there is something about gabapentin that seems to be predisposing people to viral infections, especially when it's taken as an add-on with other anti-epileptic medications. So moving down, let's talk a little bit about the drug interactions. And so ones to keep in mind are opiates. These cause a lot of sedation and respiratory depression, so you don't want to combine it with gabapentin if you can avoid it, because it will cause, I guess, more of those problems, respiratory depression, falls. So any opiates, you want to avoid it. There is Maalox, which is a type of antacid. Now that inhibits the absorption of gabapentin. So if you're taking Maalox, you want to be aware of that. Now we're going to go down to the use in pregnancy. Okay, so we don't study these drugs in clinical trials in pregnant individuals. So this comes from animals. And what they observed when the animals were exposed to high doses of gabapentin was that they caused an increase in embryo-fetal abnormalities. So we've got fetal skeletal and visceral abnormalities. So these are skeletal abnormalities and organ abnormalities, and an increase in fetal death as well. So this is a drug that is crossing placenta. It's going into the fetus. And so you should avoid it during pregnancy if you're able to. Next up, we've got the information on lactation. So this drug also goes into breast milk as well. If you are breastfeeding, you want to be looking at your child to see if there's any sedation as well, or dizziness, just knowing that it's crossing over. Geriatric use, so a word on this. If you're over age 65, this population tends to be at a higher risk of falls, and they're more sensitive to medications. So just want to be more cautious about falls and such. And so maybe start at a lower dose and go up more gradually. Renal impairment. Now, this is really important. This is a unique thing about gabapentin. So gabapentin is not metabolized by the liver. This is different from many other drugs. It's essentially excreted through your kidneys. And so what that means is you can become toxic on this drug if you have decreased renal function. So if you have chronic kidney disease, you're going to want to talk about your dose of gabapentin with your doctor, because there's a lot of charts here in this label about how to adjust the dose so you don't become toxic on it. It doesn't mean you can't take it. It just means you need to scale the dose back down to a level that's in line with your renal functioning. So now let's talk about abuse and dependence. So most people don't think of gabapentin as a drug that can be abused. However, it can be, and it's a drug that's has been abused in prisons before and also in the community. While it may not have the same reputation as a drug like Xanax, people still are taking this, and it is, for some people, there is a drug-liking effect to it, and it makes them use it more and more and in unhealthy ways. And I do know at least there's a growing awareness of this drug being abused, and at least in my home state in Utah, they've added it as a controlled substance now. So they're kind of cracking down on how easy it is to prescribe. The next thing we want to talk about now is dependence. This drug causes dependence just like all other psychiatric medications. You cannot stop it in one go. Otherwise, you'll have a nasty withdrawal. People can have problems like high anxiety, agitation, and confusion. As I mentioned previously, some people even have seizures. It causes so much rebound excitatory activity in the brain. So what this means is that this is a drug that should be tapered off. Now, a lot of people can't actually taper off by just coming down on the capsules, taking 600, 300, 100 off. And so what I recommend to people who are tapering gabapentin is that they do one of two things. One, they can go out and get the manufactured liquid. That's something you can get from your CVS or Walgreens. And then you can gradually taper down using a syringe. Another thing that a lot of people do is they'll actually take their capsules, they'll open them up, and that powder actually dissolves in water. So you could get 100 milliliters of water and just dissolve the contents of the capsule in there, and then just slowly lower it by removing greater increments from that solution with a syringe. So gabapentin fully dissolves in water. It is soluble. You can do it in that way. As I mentioned, this drug is used a lot for diabetic pain, anxiety, sometimes alcohol withdrawal, migraines, fibromyalgia. The thing that I just want to say is it does appear to, it wouldn't be being used in this if it wasn't somewhat effective off label. That's what doctors have found. That's why they're prescribing it. However, what I would caution people against is that there is a tolerance to these things. If possible, you want to take it for the least amount of time that you can. And essentially that is it. That is my overview of gabapentin. I hope you have enjoyed this video. Please share your experiences with gabapentin in the comments below. I would love to hear about them. Thanks.